Hello and welcome to the Ascend Health Show. I'm Nick Angelis. I'm your host. I'm a nurse anesthetist and the owner of Ascend Health Center. And I'm here with my friend, Dr. Michael Scaperato.
Hey, good morning, Nick. How are you?
I'm great. So you're from Integrity Chiropractic Clinic. And I was thinking today, so this is going to be a long story. Just warning everybody, maybe go back to the cat videos. In 2018, I just quit my job at Sacred Heart Hospital in Pensacola, but I still was on the corporate cup team because why not? So for our corporate cup team, our t-shirt had the 5 pillars of our hospital. And one of them was integrity, but they misspelled it, so it was integrity. So all day long, I was like, we don't really have any integrity, but we do have plenty of integrity. It's distant cousins. So will that be sufficient for you? So that's what we're going to talk about today. Not integrity necessarily, but how supplements and natural medicine is sometimes viewed as the integrity and some of the integrity of health, because there's that viewpoint of, well, it wouldn't be called alternative medicine if it worked, it'll be called real medicine. So we're going to discuss supplements and some of those integrity type of issues today.
All right, sounds like a plan, Nick.
And you might have to change your clinic name to Integrity Chiropractic by the time we're done with it.
I usually know when somebody calls, that's a telemarketer, because that's exactly how they mispronounce it. So at that point, I know whether it's going to be a good phone call or not.
That's great. So we are going to talk about supplements, and usually we have the sort of disclaimer that says don't listen to anything and view it as your own personal health advice. But we probably have to adjust it a little bit, because these are supplements. These are things that people are thinking of buying over the counter anyways. And so if we suggest it, yeah, you should buy it. At the same time, it also depends how healthy you are. For example, if you get winded walking up 4 or 5 steps, really you should, no matter how innocent anything that we say sounds today, you should really clear it with your physician. At the same time, if you are in perfect health, then don't do anything that we say, because you're doing fine. Usually, unless there's a need for your health, there is this tendency to biohack our way to wellness, and sometimes that's not really warranted. You're just kind of wasting your money and being weird.
Completely agree with that too. And not only that, but with supplements, not all supplements are made the same, just like not all care that you can be given is the same. Mm-hmm. So, chiropractors get a lot of training in the natural health room, especially with supplements. So we're usually, very particular to certain ones, certain brands, and we usually have a list of ones that we trust based on our own research, but also the research that they do. And you want to make sure to do your own a little bit too. Look into the companies, see if you can find where they source their ingredients from. That's super important, because if you think about it, a lot of supplements you may see come from overseas, mm-hmm. and they may not have the same type of protocols or the same type of criteria that makes them stand out above the rest. So if you're able to find out where things come from seed all the way to shelf, that's usually a great company. Mm-hmm. A lot of them, as you know today, also have things in the bottom saying that they have a specific third party or follow the good manufacturing processes, having more people test it, not just inside. That's also a really good criteria to check for, to make sure that they have, because it shows they're looking to go above and beyond to make sure nothing is out of order, so it's safe and effective for the patient to take.
Absolutely, because in my own training in natural medicine, I was looking at a few different programs, and some of them said certified by this organization, and then you go to that website, and then you quickly realize, nope, this is owned by the company that says that they're certified by this other company. This is ridiculous. So that is certainly something to be aware of for sure. So we'll jump into different supplements for different conditions, but another thing that we need to think of with supplements is there's also the opposite problem, where you see a really glossy label and you get really excited about an expensive supplement that's supposed to do all these things for you. And it's really just ingredients that are no different than any other brand of supplements. They just put a lot of hype and marketing into it. So, and that can be a bit more difficult to discern. I guess we could pick on essential oils for a little bit. That might be a way to describe it. So the MLM idea, where you go to church and you're new and somebody's your friend, you're like, oh, I found a new friend at this church. No, they just want to sell you some weird essential oils. So the idea there is they will have all sorts of studies on why this is the best essential oil for you. And some of them might be true, but there are studies, for example, that lavender oil can help you during a cardiac catheterization. It'll help your blood vessels, it'll help you calm down. That is a standard, normal medical study. So you can take some lavender oil. But if you look at a doTERRA or Young Living study on lavender that they did themselves, it might not have any scientific relevance at all. So you also need to see, where is the source of someone telling me that this is such a great thing. And like we already mentioned, if you don't have a need for something, then you probably don't need to biohack your way to health. You can probably just skip that supplement. We're talking more about you have an issue and you're trying to figure out, well, what can I do for my health, rather than just going to countless doctors or chiropractors or nurse anesthetists.
So is there any, one of my favorite supplements that I actually take that I think would be a good one to start off with, because you hear about it and people encounter it all the time, is acid reflux. And acid reflux, in my opinion, is one of the most misunderstood things by the medical community to help.
Right.
So whenever you go to a physician of any kind, you tell them, hey, I get acid reflux, you know, I get that sour burping, disgusting taste, you know, in my mouth after I eat really acidic foods, or in some patients I've seen with any food. What do? They give you a pill, you know, to suppress or stop your body from producing that stomach acid. That stomach acid is really important. That's your body's first ways of actually digesting and breaking down that food.
Right.
And if that step is interfered with, it's going to cause further problems along the digestive tract. So what has been seen is that your body produces that stomach acid for that reason. So, and your brain is in constant communication with your stomach, and your stomach with your brain. That's where all of our health processes really start.
Right.
And so your stomach has to be at a pH level, if you remember from high school chemistry, you know, 7's basic, or 7 is neutral, over 7 is basic, less than 7 is acidic. It has to be at a pH of 2 or below, 2.0 or below, so really, really acidic.
Right.
Not only does that break down the food, but it also helps with, you know, any unwanted pathogens that get in there. That's a way to help keep it from getting into the intestines and they're getting into your bloodstream. So your body is basically, even if there's no food there, your stomach is, you know, getting messages from the brain saying, hey, your pH is above 2. You need to keep pumping out stomach acid.
Right.
And the brain's like, or the stomach's like, oh, but there's no food there. And the brain's like, don't care. This overrides everything. So by suppressing that stomach acid, it's going to affect digestion. You could eat contaminated food and have those pathogens actually make it through the bloodstream. So 2 supplements that I recommend from a brand called Standard Process, that's one of the most typical ones you'll see at a chiropractor's office. Very natural, organic. Chiropractors can actually go to the actual farm in Wisconsin and stay for a week and then learn how they take things from the very soil and the seed they planted in all the way to a bottle on the shelf and the process that it involves.
Absolutely.
And so the one is called Zypan. That basically has a bunch of the precursors of stomach acid. And what that does is when you take that with your food, it actually helps to break down the food, so it takes a lot of stress off of that stomach from releasing that excess stomach acid.
Right.
Over time, just like with anything else, your brain in constant communication again with your body, and your body to the brain starts recognizing, hey, this stomach acid is more and more in the range where it should be than not. So it starts getting less signals to pump out more of that stomach acid with the food to lower that pH, and even when there's no food in there. And eventually the body helps the body to re-regulate itself to the point where even when there's no food in there, that pH level is still where it should be, so it's not having to pump out that extra acid. So to supplement that supplement, I recommend another one called Multizyme, and that's basically just a natural organic digestive enzyme to help break down the food even better and take even more stress off of the stomach to have to pump up that extra stomach acid to digest the food properly. So I have myself, personal testimony, had to take, you know, Maalox, Mylanta, Omeprazole, you know, ranitidine. I don't know if you remember that one from way back in the day.
That's old school.
Just shows how long I had to be on that.
Right.
And my chiropractor recommended I start taking that. And I noticed that I started having less and less of that stomach acid creeping up and that burning that I get in like that chest area, esophageal area from it irritating it. To the point now, 20 years after I probably start, even 30 years after I started taking it, I rarely have to take it, and I rarely have any issues. I have had patients that has been so severe in that they're taking with every single meal, every single day, cutting it down at least in half, which is a huge improvement for them.
Right.
And as you know, when you take those type of proton pump inhibitors, it has some negative effects to it.
Absolutely.
It actually leaches calcium from your bones, and there's been numerous studies showing that it can lead to osteoporosis or, you know, lesser bone density, which is a huge issue in itself in the country too.
Right. And one thing to think of too, what if you're listening to us and you're saying, well, I take Pepcid or Omeprazole and I'm perfectly fine. Well, we're not saying stop it tomorrow. You've got to get something natural. If it's working well for you, then you can slowly look at other options. There's no urgency here. And I had my own digestive enzyme to talk about too, but actually I've taken Zypan myself and it works really well. And if we have too long of a list, it's not going to help anyone. So we can skip on to the next category. But it is interesting, you mentioned Standard Process as a brand, and those are whole food supplements. So a lot of times people will take supplements because they say, oh, it's natural, it's not going to harm me the way medicine does. That's not necessarily true. Everything in medicine depends on concentration. So in that case, some of the Standard Process ones will say like, take 9 tablets. I'm like, well, that's ridiculous. But it's all whole food, so it's not concentrated. And that makes a difference. There's less likely to have side effects because it's basically just food in pill form as opposed to a concentrated substance.
Agreed. You know, the big key in that too is the word supplement. This isn't something that you should take strictly to replace whole food and regular, well-balanced, and meals. So it's to help supplement things that you may be deficient in, that you need, your body needs just a little bit more of. Right. I get a lot of patients that'll come in, they'll give me, a laundry list of some of the things that they're on. And sometimes it's warranted, but most of the times there needs to be a revamping and taking a look at the actual diet to say, okay, you're taking this, but where in your diet is it deficient to where we need to look at this?
Absolutely, because you can certainly take too many supplements. Again, in the natural world, you'll hear something like, well, physicians just give medicines. They get kickbacks from the pharmaceutical companies. And we don't even get pens anymore. That's not the case. But there are many natural practitioners that do get money from supplements. And that's okay as long as you're realizing where's this money coming from. Do they still have integrity, if you will, in what they're doing? And obviously if they're putting you on 20 different supplements, maybe they lack that integrity that we're referring to. So we're not telling you to be suspicious. Well, actually, I guess I am, because I'm always suspicious of everything.
It's never a bad thing to question some of the things, especially if it's like mainstream, because yes, in every profession, sometimes they get a little bit wrong and needs to be revamped. But that's where also asking your physician the questions and doing some of your due diligence of finding some of the things out on your own from other reputable sources, and then combine the two and be able to help make a good decision for yourself.
And realizing when something isn't working. So you can have a personal health philosophy, like maybe you want to be vegan, and then you get pale and sickly. You have to realize, I'm wrong, this isn't helping me. So having that humbleness, because that's what holistic care really means. You're just looking from a wider array of options as opposed to being dogmatic about a certain path to get healthy.
Absolutely.
Because you have to think like, well, what is my priority here? Maybe it's not to get healthy. Maybe my priority is to be right. I have to be honest about that.
Sure.
So another, and I do enjoy digestive enzymes. I think they're really helpful, especially when you're digesting food that isn't good for you. Like if I go out and eat pizza with somebody, for example, digestion is huge for us as nurse anesthetists as well, because we're so worried about aspiration and coughing food into your lungs basically under anesthesia. So a similar topic would be immunity, and one of my favorite for this is the supplement interface. So it is an enzyme. It's not one that you take with food, it's one you take away from food so that it starts breaking down the bacteria in your large intestine, because many bacteria are smart and they have slimy coatings that prevent probiotics from really colonizing the large intestine. And so by taking something like this, you actually start eating away at the bad bacteria, and there's more room for correct colonization. Because the way a lot of medicine works, it will just work on a receptor site, block that receptor site, it's done. But sometimes a healthier way is to work with your body. So a supplement that will provide some competition for the germs is much better. The way that antibacterial soap can sometimes harm the flora on your skin, and it's sometimes better to just avoid that completely if you want to be healthy. So with your immune system, one of the segues between digestive enzymes and digestion and immunity is something like interface, where it will start eating away at the bad bacteria. Do you have any particular supplements or philosophies about immune support yourself?
Absolutely.
Because again, it is like digestion, it is a bit of a vague, a lot of people can say, oh, take this, it'll help your stomach or it'll help your immune system, and sometimes it can be too vague to really nail down, like, what do I actually need here?
Right. So I have a a colleague as well as somebody else that I've gotten to know that is really big in the chiropractic community, and he had the quote that runs along the lines of, we don't have an immune system, the body itself is an immune system. Because if you look at every single system in the body, whether it's the digestive system, if it's the respiratory system, it has its own immune cells. So the whole body in itself is like an immune system complex that kind of works together along with the lymph system and the nervous system. So one of the big ones for me has been vitamin D3, but you got to make sure it's with K2. D3 has numerous processes in every system in the body, and one of them being the immune system. It helps to regulate that immune system and its effectiveness. But you need that vitamin K2 with it, because that K2 helps to drive that D3 molecule into the cell and have it start with the cellular processes. Now, just like I mentioned before, sometimes some of these supplements may not be the best for you. For example, if you have any clotting issues, or if you're on a blood thinner like warfarin, or even taking, baby aspirin after a heart surgery that you have to keep taking, that interferes with the clotting factors, because K2 will help your body to clot whenever you get a cut, but it can actually affect, say, if you had a heart valve replacement, or if you are on those, for any other medical reason. So you'll want to avoid taking the D3 with the K2 and try to get some of that into your diet naturally. But of course, you want to check with your physician, whether it's your primary care or your surgeon or specialist, to make sure that even getting that in your diet. So that's where some of the can I or should I really comes in, and having a good communication, good relationship with your healthcare practitioner on it. But for general purposes, for people who aren't on blood thinners, that K2 and that D3 is really, really important, because other than that, if you don't have that, then it keeps circulating around the blood. And that's why you may have a high blood concentration, but not a high cellular tissue concentration, which is not only hard to measure, but also some of the effects can be masked by other things. So when it comes to immunity, that's always been a gold standard in a way of keeping your immune system healthy, regulated, and ready for any infections that you may incur.
Absolutely. And in psychiatry, Mark Gerritsen, one of our nurse practitioners at Ascend Health Center, he always recommends D3 with K2, because there's so many studies on what D3 does for your mental health. So we'll get to mental health in a second, since, again, Ascend Health Center, rise above emotional and physical pain, that's kind of our thing. But I did want to talk about cardiac, since you mentioned some vascular issues with the K2, because I take D3 and then I just eat some spinach and I'm good. So usually we're a bit more cautious about, hey, you don't need your low pressure and your Plavix, take some supplement and see how it works out, because you have to also think of why are you taking medicine. So in some cases you'll take cholesterol medications or a beta blocker for your heart because you're trying to prevent something that maybe has some side effects, but you're looking to prevent that heart attack. So it's a little different than a medicine that you're taking day to day to block a receptor site because of an active problem. So, and there are cases, I had a family member who was going to Greece, and I was like, I know the doctor said maybe we'll start you on Plavix, but Greece has a lot of rocks. You'll fall, crack your head open and die. Why don't we look at some supplements? And we did come up with an idea. Although that idea I'm not telling my viewers, because again, it's a little bit trickier when you're talking about clotting, vascular systems, heart. And Standard Process does have some heart healthy supplements, but these are things that you want to have your home blood pressure. You want to monitor a little bit more carefully, because again, some supplements make vague promises, and when you're looking to substitute things, it's a little bit like when you're trying to take a homeopathic instead of getting a vaccine. Like, this is a completely different story. We're looking at two different ideas. You can't substitute one for the other. So now we can switch to mental health, because I suspect we'll only get to one or two more of these categories. I mean, like most of our shows, we haven't really talked about this. We're just, I don't want to say making stuff up as we go along, but simply sharing our expertise. Ooh, that does sound a lot better than making stuff up as we go along.
Yeah. Making up on the fly.
I'll have to remember that. So for mental health, one of my favorites would be magnesium glycinate. So at Ascend Health Center, we do ketamine infusions. The NMDA receptor has glutamate and glycine on the molecule. For the first few years that I started the clinic, I actually didn't mess with glycine or magnesium glycinate, because I'm like, well, it's a very complex relationship, because you're taking the glutamate in your body, which is inflammatory, channeling it in your nervous system, and that creates neuroplasticity and all these welcome changes to kind of shock the body out of anxiety and depression. And it's more of a philosophy of supplements, like, hey, let's not be on something for the rest of our lives. Let's get this done and move on. So magnesium glycinate, magnesium threonate is actually better for your mental health, but but it's also more expensive. And I think we need to be practical when we talk about these sort of things. It's not like health insurance where it's like a pathetic Groupon that it may cost you nothing or it may cost you a lot, and sometimes the actual care that you're getting isn't great. So with magnesium glycinate, the glycine will help with anxiety. It helps your neurotransmitters, and the magnesium is involved in multiple processes in your mental health, your physical health. So that'll be one of that just off the cuff.
Yeah, so when it comes to supplements, there's a whole list of things that can be used for mental health. You can have Korean ginseng, which helps, speed up the mind, and get the mind alert like coffee. So it can help with depression symptoms. Right. It can help with those motivation symptoms. D3 can help with mood as well. They have found those that have lower levels of those D3 levels can actually affect your mood too. So on top of supplements, one of the things I offer at my office, it's not so much a supplement pill-wise, but it's a form of biofeedback called Inner Voice. And what it does is I put these cool little headphones on you with a speaker, and you speak into the headphone, and it measures the different pitches and ranges of your voice. And it finds that when your voice gets out of tune, like a guitar can get, it can actually affect how well you deal with stressful situations. And who here doesn't deal with stress? And stress can really have a very big impact on our mood as well as our mental abilities too, So it can help support, supplements that deal with depression. It can help with supplements that deal with anxiety. But what that does is you listen to the opposite tone on a musical scale, and they have found that it actually helps to kind of rewire that brain, that inner voice, so to speak, to help with the different mood disorders. So it's not so much a treatment as much as it is a support more than a supplement for mental health.
Absolutely. And there's theanine that I like. There's a lot of other supplements that also are helpful for both anxiety and depression. Sometimes I'll tell patients just to take an Epsom salt bath, because with magnesium, the way it's absorbed, it can be difficult to just take it orally. But one thing I want to talk about too is my least favorite supplement, and I think I'll probably ask you what's like the worst fraud in natural health. But my least favorite supplement is actually St. John's wort. So it should help with your serotonin levels. I tried previously to use it to get a patient off of an SSRI, but it just doesn't play well with others. It's really hard to manage, and it's a waste of everybody's time. So that's just what I didn't think of that before I started with Ascend Health Center in 2019, but since then, as I often try to get patients off of their medications and trying more natural approaches, I think it's just a waste of everybody's time.
Yeah, St. John's wort, right person for the right situation. Unfortunately, you hit on the biggest thing with it. Is it seems like a lot of medications out there, if you look at you should actually read the labels on those, even if you don't understand all of it, because you'll be able to pick out something in there. One of the things I see most frequently is, do not take St. John's wort with this, because it interferes with a lot of the processes of them. Right. So if you're able to take it, talk to your healthcare practitioner as always. It may help a little bit, or may help in conjunction with something. I've also learned, lion's mane and Reiki mushrooms. Those are ones that also have been found to be nearly or as effective as St. John's wort or some of the other supplements out there too. So there's a wide range and variety of things that can be done. If you read about one, it says, hey, this sounds like it may be for me. It may be, but talking to your healthcare practitioner will help you decide whether that's the right one or if there's something better for you. Right,
because if you're having side effects, like, why are you bothering with natural medicine? Go take a pill and be done with it. The whole point of what we're doing is working with your body to avoid side effects. And again, sometimes you need a medicine, and that's all there is to it, and you have to endure the side effects and the end of the story. We're not saying that in every case you have to find a natural alternative. I've tried that before in my life, and that was a lot of hard, wasted effort.
Yeah, absolutely. And another one I think that's really good, you mentioned that before, for helping with mood, lavender. Lavender essential oils. I know that, putting a drop or two into a bath and, even in the shower, just having that steam rise up from it has been tremendous for helping people to just get more relaxed after a really stressful day.
Sure. Have you seen any problems with it being estrogenic or any issues like that? Or
I personally haven't, no. I do know that some people may have like a skin sensitivity to it, so it can make them break out in like an eczema or a rash. And of course, in those cases, you want to discontinue that and look into something else.
Sure, absolutely. And then our last category, since we're running out of time, would be mineral support. So there is a branch of natural medicine called orthomolecular medicine, where they feel all the electrolytes and minerals balance themselves. Like on one side you have zinc, on the other you have copper, on one side you have calcium, on the other side you have magnesium. And there's a lot of tests you can do, like hair mineral analysis testing. And sometimes it actually goes back into that fraud category that we briefly touched on. But I think a lot of times with mineral supplementation, it's the same thing as we said before. Can you notice a difference? Like, again, you're a chiropractor, I'm a nurse anesthetist. We both have the privilege of people can tell very quickly if we know what we're doing. Because if they say, no, he's the best chiropractor I've ever been to. He'll subluxate you like no one else can.
Or have trouble getting rid of them, you know,
Right,
as
exactly.
what they should help with.
But do you have any particular mineral supplementations or any opinions on that in particular?
Yeah, so when it comes to mineral supplementations, you know, that's one of the ones that I usually use, again, for immune system support.
Okay.
So zinc. Zinc is probably my favorite one and is one of the ones that people tend to be most efficient in. So, you know you have a good company because some of them will have a zinc test where they actually have you take some zinc orally, and zinc produces typically a very metallic taste. So when you have that metallic taste, that means your body is actually deficient. And you want to be able to have more zinc in your diet. And again, just where it's sourced is always important. Of course, you know, myself, I have my personal recommendations, the one that I like. But also for the immune support back on that, you know, zinc has been shown to help prevent viral replication. So you prevent viral replication, guess what? That number of the viral infection starts to dwindle. So having a good zinc and a good supplement on have, even if you don't want to take it every day, is great just to help with shortening the time of sickness.
Now, is it zinc picolinate or is there a particular type of zinc? Or
So you want to look for chelated zinc. That is the key word and the thing you want to look for on the bottles and the ingredients. There's multiple ways that can be done, but as long as it's chelated, that's going to help your body to absorb and use it right away. Something that's termed bioavailability. And those that have a higher bioavailability means your body can use it right away. It doesn't just circulate and the body's not quite sure where it needs to go and then just gets rid of it after a while.
Sure. Well, we're almost out of time. Actually, we're completely out of time. So where do you work and what do you do again if people want to learn more about you?
Yeah, so I'm at Integrity Chiropractic Clinic in Fairlawn, right on West Market Street. I'm in these big white medical buildings. I'm in the back. They put me I'm on the top floor corner suite so we can do all the adjustments and popping and laughing and not bother anybody. Offering not only chiropractic treatments and a dietary supplement line, but the biofeedback called Inner Voice, decompression table for those pesky disc issues, and then I also do custom orthotics because, just like the foundation of a house, if the foundation is off, everything above it can be affected too. So having something that's made for you and your foot, and not just grabbing something off the shelf and thinking, oh, this may help, that actually makes sure it's for you and your foot only.
Absolutely. And I'm Nick from Ascend Health Center. We do TMS, ketamine, psychiatry, counseling. We specialize in people who haven't been able to find answers anywhere else, and we're across from Copley High School. So thanks again for watching.
You are watching WCTV, Wadsworth Community Television.